The 7 steps of the Partnership for Health Medication Adherence Strategy for conducting a brief adherence counseling conversation with patients can be adapted as needed for each follow-up visit. In this video, Kevin connects with Dr. Morales by telemedicine video conference call for a follow-up visit. Once they've connected, Dr. Morales begins the visit with the first step, establishing trust and communication, and asking questions to follow up on Kevin's medication adherence.
Good morning, Kevin.
Morning, Doc.
How have you been since our last visit?
Pretty good.
Glad to hear that. I have your labs pulled up, and I've got to tell you, Kevin, things look really good in terms of your CD4 count and your viral load. Tell me about your experience with taking your meds every day in the morning.
It's going pretty good. I have plenty of time to take my pill with breakfast, and I have the app notifications to remind me too.
That's great to hear. It's not always easy to remember new routines, so I'm glad to hear the phone notifications help and that the new schedule is working better for you.
Yep.
Now, the last time we met, you said something about missing 1 or 2 pills a week. How many do you think you've missed in the last 3 months?
I've done a lot better. I've only missed 2 pills, and that was a couple of weeks ago.
Step 2 is to emphasize the importance of adherence.
Oh, that is great progress. Good. In order for the medicine to work best, it's important to take it every day to maintain a constant level of the medicine in your body. Tell me a little more about when you missed those 2 doses. What was happening?
Well, one day we had inventory at work, which is a long day for everyone. And a few days before that, I worked a double shift. Both times I was just tired and slept in the next morning. I didn't wake up from my alarm or anything. By the time I remembered my pill, I wasn't at home and figured I would just take it the next morning and get back on track.
Sure. It's best to take your medication at the same time every day. If you miss one at the scheduled time and you remember it a few hours later, you can go ahead and take it then. If it's much later, with less than 12 hours until your next scheduled dose, then wait to take your next pill at the usual time.
Steps 3 and 4 are to discuss the treatment plan and ask specific questions about the patient's adherence.
What do you recall about your adherence plan from our last visit?
I know I had missed a few pills when I last saw you. Working evening shifts was new. I'm still getting used to it, actually. I've done a lot better since I started taking my pills in the morning.
I'm glad to hear that mornings are working better for you. The last time you came in, you said you weren't feeling any side effects. How have you been feeling since then?
I feel a little tired, but I don't think it's the medicine, honestly. I'm still adjusting to the new work schedule.
That's understandable. Overall, it's great to hear that you've almost eliminated missed doses. That's no small feat with how hectic your schedule can be. And because things can catch us off guard sometimes, like working an extra shift as you described, let's see if we can get in front of potential challenges. What do you think could impact your medication schedule?
Well, the last 2 times I missed, I could have taken my pill if I had one with me. I just wasn't at home when I remembered. So I suppose I could start keeping a few pills in my backpack. I never leave home without that, really.
Step 5 is to problem-solve barriers, identify strategies, and set a behavioral goal to improve adherence.
That's a good idea. It sounds like if you had some of your pills with you, that would have helped you a couple of weeks ago. How would you feel about using a small pill container? Something that can go right on a keychain or in your backpack?
Oh, I've seen those around the clinic, I think. Yeah, I can keep something like that in my backpack for sure.
Okay, great. I'll have one sent to you. I'd also recommend putting fresh pills in it when you get your refill. That way the pills you keep in your bag won't expire. You can also set a reminder on your phone to fill it. Speaking of, tell me more about the app you've been using for your pill schedule.
Sure. It's linked to my calendar and notifications.
Okay.
There's an icon so I can see the next scheduled dose, and I can even access the history so I can see how many pills I've taken in weeks, months. The notification alarm is really the most helpful thing, though.
Okay. It's good to hear you tried it out and found what works for you. Were you able to check in with your case manager as well, like we discussed?
Yep, I talked to her. She's the one who helped me find this app, actually.
I'm so glad to hear that. That's really great. So it sounds like the morning routine is working for you.
Yeah.
Steps 6 and 7 are to create a tailored medication schedule and motivate the patient to commit to an adherence goal.
Okay, well, since the new morning schedule is working for you, let's keep it the same. Can you check in with your case manager again before our next appointment, especially if anything comes up? You're not on your own, okay?
Okay. Thanks.
Finally, follow up with the patient about adherence before the end of the visit.
Well, everything looks good. What questions do you have for me?
Nothing comes to mind.
Well, if you think of any, jot it down and you can run it by your case manager, or run them by me at our next appointment.
Yeah. Okay.
I'll enter your prescription refill for the next 3 months, and I'll tell the office to call you to schedule our next visit.
Okay. Thanks.
So, just to briefly recap, taking your pills in the morning has been working for you, so we're going to stick with that. You'll get a pill container in the mail soon to keep a few pills in your bag for times you might need to take them on the go.
Okay. I'll watch for it in the mail.
Okay, so like we did this time, be sure to get your labs drawn a few days before your next scheduled telemedicine appointment so we can talk about those results at the visit. And again, please call or set up an appointment if anything changes in the meantime.
I will.
Okay, other than that, I just want to say you're doing a great job with your treatment. I look forward to talking with you again in 3 months.
Thanks.
Goodbye, Kevin. Stay on the line and the health tech will work with you to schedule the next telemedicine appointment.
Bye, Doc.